How is attenuated psychosis syndrome diagnosed? Have you ever wondered how mental health professionals identify conditions like attenuated psychosis syndrome? This diagnosis is essential for understanding early signs of schizophrenia and related disorders. Let's break down the process. Attenuated psychosis syndrome, often referred to as APS, is characterized by milder symptoms that resemble psychosis but are not as intense as those seen in full-blown psychotic disorders like schizophrenia. Individuals may experience less severe forms of delusions, hallucinations, or disorganized speech. Importantly, they typically maintain a clearer sense of reality compared to those with full psychosis. Diagnosing APS requires a thorough clinical evaluation by a psychiatrist or trained mental health professional. This process often involves structured interviews designed specifically for assessing psychosis risk. Two commonly used tools are the structured interview for psychosis risk syndromes and the comprehensive assessment of at-risk mental states. These structured interviews help professionals determine if the symptoms are truly attenuated and differentiate APS from other mental health conditions. Several key factors are considered during the diagnosis. First, the frequency, severity, and duration of the symptoms are evaluated. The symptoms must be significant enough to warrant clinical attention but not severe enough to be classified as full psychosis. Next, the individual's mental state is assessed. This includes evaluating cognitive function and their perception of reality. A review of personal and family psychiatric history is also important, as it helps identify any risk factors or coexisting conditions that may influence the diagnosis. Current medications and substance use are taken into account as well. These can significantly impact how symptoms present themselves. Additionally, accompanying symptoms like depression or anxiety are often present in individuals with APS, and these are also considered during the diagnostic process. The criteria for diagnosing APS have evolved over time to clarify the nature of the symptoms. Earlier confusing language about intact reality testing has been removed to better define the line between attenuated and full psychotic symptoms. Identifying APS is vital because it often indicates that an individual is in the prodromal phase of schizophrenia or other related disorders. Early intervention can be beneficial, as it allows for treatment plans aimed at preventing or delaying the onset of full psychosis. In summary, diagnosing attenuated psychosis syndrome involves a careful clinical assessment using standardized interviews, along with a thorough review of the individual's mental and medical background. This process helps identify early signs of psychosis risk and guides appropriate interventions.